Today we will be taking a look at type 1 and type 2 diabetes, specifically during pregnancy. Joining me today will be expert Katelyn Sushko. Katelyn is currently in her final year of the nursing Ph.D. program at McMaster University. Her research is based primarily on ways to support mothers in diabetes self-management during the antenatal period. This video will be broken up into 4 main sections, starting off with what is diabetes, where we will learn about what diabetes is. We will then look at ways in which an individual can manage diabetes. We will then go on to complications associated with becoming pregnant with a previous diabetes diagnosis. This video will then conclude with what the future looks like surrounding this research. So, what is diabetes?
Diabetes can be broken down into 2 main types, which include both type 1 and type 2 diabetes. Type 1 diabetes occurs when your pancreas fails to make enough insulin. This lack of insulin is primarily due to the individual's body attacking the islet cells in the pancreas that make insulin. Insulin helps glucose enter your cells and then allows your body to use this as a source of energy. Without insulin being present, glucose is unable to enter the cells and builds up in the bloodstream. The other type of diabetes, type 2 diabetes, is the more common form of diabetes. In type 2 diabetes, although the pancreas may be making insulin, the individual's body is resistant to the insulin. Due to insulin resistance, glucose cannot enter the cells and builds up in the bloodstream.
How can an individual with a diabetes diagnosis manage their diabetes?
In order to manage type 1 diabetes, since there is a deficit in the amount of insulin within the body, an individual with this diagnosis would need to take insulin shots or wear an insulin pump throughout their everyday life. An individual with this diagnosis can also make some lifestyle and dietary changes, such as counting carbohydrates, fats, and protein, as well as exercising regularly. In order to manage type 2 diabetes, an individual can try some things in order to control their blood glucose, which include healthy eating, regular exercise, regular blood glucose monitoring, and sometimes weight loss or insulin therapy.
What are some complications with being pregnant with a previous type 1 or type 2 diabetes diagnosis?
Globally, type 1 and type 2 diabetes affect between 0.5 to 2.4% of pregnancies. Unfortunately, there is a high prevalence of perinatal complications among women with type 1 and type 2 diabetes. Complications can range from short stays in the neonatal intensive care unit for neonatal hypoglycemia to fetal and infant morbidity. Furthermore, perinatal mortality, stillbirths, and infant death within the first 7 days of life have not significantly declined and remain elevated among women with pre-existing diabetes compared to women without diabetes. While maternal hyperglycemia in the first trimester is associated with an increased risk of congenital anomalies and miscarriage, hyperglycemia in the second and third trimesters also have significant post-birth consequences for the developing fetus. Some of the most common complications in the postpartum period associated with hyperglycemia in later pregnancy include macrosomia, respiratory distress, and neonatal hypoglycemia. The occurrence of macrosomia, defined as a birth weight of 4,000 to 4,500 grams among infants of diabetic mothers, occurs as a result of placental function. Women with type 1 and type 2 diabetes are treated with insulin during pregnancy to maintain normal glycemia. Although glucose crosses the placenta to the fetus, insulin does not. In response to maternal hyperglycemia, the fetal pancreas produces large amounts of insulin to maintain glucose homeostasis. Excess insulin can then act as a growth hormone for the developing fetus.
Thank you. I just have one final question. What does the future look like surrounding this field of research?
There are many directions where research in the field of diabetes can go in the future. Specifically related to diabetes in pregnancy, and as rates of diabetes in pregnancy increase along with serious complications, future research should be directed towards reversing the increased trend of type 2 diabetes in women of childbearing age. In addition, research should focus on reducing the occurrence of the serious complications associated with diabetes by improving preconception and perinatal care.